Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 49 new cases of COVID-19 in Windsor and Essex County. 18 are close contacts of confirmed cases, 8 are community-acquired, 1 case is travel-related outside of North America, and 22 cases are still being investigated. We have had 14,893 cases since the beginning of the pandemic. 14,021 cases are now resolved, and 461 people are active at this time. We have 550 preliminary or confirmed variants of concern identified in Windsor-Essex County, with 477 cases having the UK variant, 2 cases having the South African variant. 133 of our active cases have the variant. 17 people from Windsor-Essex County are currently in the hospital, with 2 people in ICU. Our community has lost 411 people to COVID. Today, we are reporting that 2 people from the community have passed away due to COVID-19, a woman in her 70s and a man in his 40s. There are currently 6 active outbreaks in Windsor and Essex County, 5 workplaces, and 1 school outbreak. Now for our vaccine update, a total of 136,289 doses have been administered to Windsor-Essex County residents. 123,069 people have received at least 1 dose. We are currently vaccinating people 60 years of age and older across our mass vaccination sites. In addition, those people that are 50 years of age and older living in one of the identified hotspot postal code areas can be vaccinated. These are neighborhoods where your postal code begins with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. When you attend your appointment, please bring proof of address, whether it be a driver's license or a current utility bill or other bill. Anyone living in these areas requiring transportation, please contact Vets Cab in Windsor or Sun Parlor Taxi in Leamington. Free transportation has been generously arranged by the Chamber of Commerce. In addition, Transit Windsor is offering free bus service to mass clinics in Windsor. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca, or if you need assistance, please call the call center at 226-773-2200, and someone will be able to help you. For general inquiries regarding vaccination, please call 211. We'd also like to remind residents that individuals 40 years of age and older may now be vaccinated at one of the participating pharmacies in Windsor-Essex County with AstraZeneca. We would also like to remind you that despite the vaccine rollout, public health guidance is still necessary. Maintain a 2-meter distance from anyone outside of your household. Wash your hands with soap and water regularly or use an alcohol-based hand sanitizer. Wear a face covering in public spaces outside of your home. Avoid touching your eyes, nose, and mouth with unwashed hands. And stay home if you are sick. Get tested if you have any symptoms or signs of COVID-19. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again. As you note, we are talking more and more about variants of concerns. Mutations in viruses happen all the time. One of the good examples is the flu virus. It mutates all the time, and that's why we need every year a new vaccine for influenza. With little to no immunity worldwide for SARS-CoV-2 virus, and with a significant transmission going on everywhere, there are more opportunities for this virus to replicate and mutate. Mutations can occur anywhere in the genome of the virus, including the receptor binding proteins. Any changes in the receptor binding proteins can result in altered host immune response. Public health work is more concerned when these mutations and variant occur, especially when it is linked with increased transmissibility or detrimental changes in COVID-19 epidemiology, an increased virulence or change in the clinical presentation of the disease, or decreased effectiveness of public health and social measures, for example, diagnostic methods, mode of transmission, vaccines, treatment, etc. Today we reported two variants of concern that are identified as South African variant. What is more relevant to know that based on the available scientific data, the South African variant is more transmissible than the original SARS-CoV-2 virus. We don't know if it leads to more severe disease, but we do know that UK variant leads to more severe disease. It can still be detected by the molecular and antigen testing that we are using regularly. The key impact for this particular variant of concern is that all the available vaccines may not be as effective for this particular variant of concern. I can understand that we are all tired following the public health guidance to protect ourselves from the original SARS-CoV-2 virus. With the introduction of these VOCs, we are not only fighting one pandemic, we could soon end up having two pandemics, one with the original SARS-CoV-2 and the other one with the variant of concern. We have come a long way. We have done our part. We will get there together. We will continue to ensure that case and contact management are happening as quickly and efficiently as possible. We need your support. Please follow the public health guidance and limit your number of close contacts at all times. Get the first vaccine available to you as quickly as possible. Stay safe. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Yes, this is the second time in recent days that a person in their 40s has died of COVID-19. I'm wondering, did that person have any underlying condition?
So we have stopped reporting additional clinical details for all these individuals and recognizing the privacy of all of these individuals. So we don't comment on that in our broadcast, but clinically we do know that there are individuals who are more likely who are susceptible to the virus. But then there are other individuals who get more severe disease and even died without even having any pre-existing medical conditions. So I think at this time, I don't want to undermine the impact whether someone has a pre-existing medical conditions or not. It is a serious virus and it is killing people at different ages. Obviously, the higher the age, the likelihood is high for people to develop more severe consequences. But even in younger age group, it doesn't mean that if you don't have any pre-existing medical conditions, you will be okay. So we'll just leave it there, but those are strong messages and strong reminders for people that it's not necessarily just the older people who are dying. There are younger people who are also dying as a result of COVID.
And does the health unit have any information to share about patient transfers to local hospitals and how many patients were expected to receive from other areas that have been harder hit by the third wave?
Well, we do work closely with our hospital partners in ensuring that our local capacity and the health system capacity is maintained, and those conversations are ongoing, but these information changes rapidly every day, and depending on what transfers are required, those are happening all the time, and it would be hard for me to pinpoint and exactly say that what to expect in the coming days. We are here to support our community, our rest of the health unit, and we'll continue to do that as long as we have the capacity. There was a time when we sent out our patients to other regions, so it's now our time that if we are in a better position, we should support all the other communities that need our help.
Thank you. And just one clarification, is this the first time that the virus first found in South Africa has been discovered locally, or the variant, I mean?
Yes, that is correct.
Okay, thank you.
Any questions from Blackburn?
No, today, thank you.
Any questions from Windsor Star?
Not at the moment, thank you.
Any questions from AMA 100?
Dr. Abed, you mentioned about the variant and the concerns of the variant. So I just want to make sure I heard it right. So if someone gets vaccinated, this variant could still impact them?
Yes, that is correct. And we obviously, this is an evolving area of research, but based on the initial information, it is possible for that individual to get the South African variant despite the fact that they are vaccinated.
With the three variants, the South African, the United Kingdom one, and the Brazilian one, which one is the worst? Is it the South African, Brazilian?
It's hard to say, Rob, at this time. I think they all have different characteristics, and I think the world has seen much more of the UK variant in terms of the disease transmissibility and the severity of the disease. We haven't seen many cases linked with the South African and Brazilian variant here. So it would be hard for me to say that which one is more dangerous. I think these are all variants that could lead to more severe disease, and we just don't have enough data to do comparison across these variants, but they're all significant, and that's why they're being reported as such, that it does has the potential to spread more quickly, it does have the potential to cause more severe disease, and obviously the other concern is the vaccine effectiveness in each of these variants.
And one final one, I'm not even sure if you can get into this, but of the cases today, the one travel related outside North America, obviously we have a stay-at-home order in place. Are you or the health unit looking into this to see why this individual left the country and outside of North America?
I think we'll have to wait for the full investigation. There may be a situation that maybe this person was outside or left the country before the stay-at-home order came into effect, or maybe as a country we cannot deny any Canadian returning back to the country. There may be various reasons for that, and I really can't specifically comment on those specific cases, but when we do look at it, we do look at the risks and try our best to follow the available restrictions and guidelines to ensure that not only we are keeping the community safe, but also trying to work through our partnerships to ensure that incidents like that doesn't result in widespread transmission, even from the travel or going through different places.
Thank you.
Any questions from CTV?
Yes, good morning. I have a question about pregnant women and vaccinations. The University Health Network in Toronto has acted on the advice of doctors pushing to get pregnant women fully vaccinated, saying that the risk is higher than the general population. And the UHN is allowing pregnant women to sign up online to request their second dose 1 month before the due date. But one of our reporters says a local woman has been asking the health unit and has been told there isn't an opportunity to get a second dose before 4 months, that it doesn't exist here. What is the basis of that decision?
Well, the National Advisory Committee on Immunization has provided the guidance in terms of who can benefit from the shortened interval, and there are various advocacy groups, there are various patients group, where there is very physician group who are supporting one way or the other. All of these information need to be looked at in a scientific way. I don't think that there are enough scientific data to validate at this time that the pregnant women are at a greater risk. There may be. I'm not saying that they may not, they won't be, but we don't have enough scientific evidence to say that. Otherwise, if we have unlimited vaccine, we wouldn't be even having this discussion. So I think the whole balancing act of ensuring that we are equitably distributing vaccines as quickly as possible to everyone who needs it, that's the key question. It's not about whether we prefer one group or the other. We are all at risk of getting COVID. We are all at risk of developing more severe complications. The benefit of giving one vaccine and then extending the interval is based on other data in terms of the vaccine effectiveness, and we are monitoring that data, and we'll continue to look at that data. But the guidance basically came from NACI, which is provided who gets the most benefit from shortened interval, and that is being followed locally.
So what is your advice, I guess, to pregnant women who are concerned at this time?
Well, everyone needs to take precautions. Everyone needs to be safe in terms of reducing their close contacts. That doesn't change for anyone. Everyone who is in that situation, I think they're more. They should pay more attention to what they're doing and where they're going and how they're contracting, how they may come in contact with anyone who could be at a high risk of transmission. So.
Okay, changing gears a little bit. In Peel Region, they issued an order about workplaces requiring anyone with 5 or more cases that the business shut down for 10 days. Would you consider a similar order here, given that there are 5 workplaces with outbreaks?
Well, I got that update from my colleague Lawrence Lowe from Peel, and we are looking into it. And yeah, they have they have formalized their process, but from our local perspective, obviously, we are looking into the situation, and even if we find any risk that is attached to the outbreak, and if we feel that the risk is high enough, we have taken action before, and we won't shy away from taking the action again. I'm not entirely sure about having a Section 22 order similar to what Peel has in place at this time, but again, we'll look into it and we'll see how it will impact or how it will work in our community, and if it's needed, we'll do it. But at this time, I think it's really too early for me to comment whether or not we'll do something similar.
And have you received any updates on the rapid testing for workplaces that the provincial and federal governments have talked about?
Well, we do get some involved in the discussions of these testing. Most of these testings are voluntary testing, and these testings are because it's asymptomatic testing. These testings are done in workplaces that do not have any current outbreak at this time. So truly going back into the asymptomatic surveillance testing piece, and we're not directly involved, but we are involved in the initial discussion and the planning pieces.
Okay, thank you.
Any questions from Radio Canada?
Yes, good morning, Dr. Hamed. I wanted to ask you a question, actually 2 questions regarding vaccination, but after what you said with the South African variant, I don't know if it still makes sense, but I'm going to ask my question anyway. So do you think there should be any right or benefit linked to the vaccination? So do you think people who have received the vaccine should be allowed to meet?
Great question, and I think we need to again go back and follow the evidence and science based on all these vaccines and how people should be protected. The general direction or the general principle for vaccinating everyone is when we have a good vaccine which is effective, then it should prevent any kind of transmission. And the vaccination has already started in many parts of the world. A good portion of United States is already vaccinated. We are getting close to a good chunk of our population vaccinated. How it will impact on the ongoing transmission of the disease, that would help us to feel more comfortable with using the real world data in reducing the transmission of disease in the community. If we get to that point, we'll definitely support that. Yes, people who are vaccinated, maybe they don't need to take precautions, but we're not there yet. We are still looking at the data. We are still looking at the evidence. We will get there at some point because that's the whole idea of vaccinating everyone, but it's too early, and we'll continue to look at the data and the evidence before some of these recommendations. Obviously, it will come from the National Advisory Committee on Immunization in Canada, but even to feel more comfortable locally, I think we need to look at the ongoing evolution of the scientific data that we are seeing right now.
Okay, so I think you already answered my second question, but just to make sure I got it right. So I think right now I see the numbers. So we have more than 100,000 people that have already received the vaccine in the Windsor-Essex region. So again, and I know I'm pretty much asking the same question. So if I receive the vaccine and my father or my parents or my grandparents actually receive the vaccine, we may be allowed to see each other, but as you said, we need to see the data first. And you maybe in the future you will agree with that, with having people meeting together.
Yes, absolutely, and I think when we have enough data to suggest that, yep, people who are vaccinated, they are safe to be in the same spot, that's where we will eventually go, but that is not the direction at this time, so just want to be clear. Even if you are vaccinated, you should take all your precautions when you're vaccinating someone, when you're meeting someone who doesn't live with you. You have to take all the public health precautions that will continue to be in place until we change our recommendations for people who are vaccinated, and maybe they may engage in some activities that could be considered as low risk, or people from the same family, like father or mother or parents. You can get to them, but it's not the direction at this time.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, Premier Ford's office has put out a statement indicating that in addition to the delays expected with the Moderna vaccine, is now expecting delays with shipments of the AstraZeneca vaccine. Does it feel knowing that our region and the province has the capacity to be immunizing a lot more people much more quickly, but it's all down to supply shortage, so we can't get this done more quickly?
Yeah, no, it is obviously not a great news to hear about additional delays, because the more we delay, the more opportunity we are losing to protect our people before they contract COVID or before further transmission happen. But that's the reality that we are in, and it's not only impacting our community, but it's impacting other community as well. I'm sure that the other regions also have more capacity and they could use more vaccine. And it's the unfortunate situation that we are all in with limited vaccine availability. But we really hope that with additional doses of Pfizer coming into the country, we should at least ramp that vaccine up, even if there are other delays. But these delays definitely challenge us, all of us in the health system, to be prepared and to ensure that our plans and everything are solid in place to allow the continuity of our operation as well as our vaccination. Teresa and the team have done an excellent job in monitoring that part of the operation to ensure that we have the maximum capacity and efficiently vaccinating all the people in the region, and working with our partners, with Windsor Regional Hospitals and our municipal partners and everyone who's involved in it. I think we've got a good system, and we just hope that we don't have to deal with it so many times, and that we get more vaccine to vaccinate our people.
You said that with the variants, it's possible we could have two pandemics on our hands. You also said that it's possible that the vaccines that we have now may not be effective against some of those variants. So why should people get vaccinated knowing that it's possible that this isn't going to protect them from everything?
Well, I think still it's too early at this time that how much of these pandemic or these different type of variants will get a foothold in any of these regions. The aggressive case and contact management piece, and then with the enhanced measures, we should be able to contain the spread of the disease. We have a good portion of our community under shutdown and stay-at-home order, so we hope that we can reduce the transmission of these specific variants of concerns, and with more and more people vaccinated, we certainly hope that we will we'll get it all under control. And then as we talked about the mutation in the viruses, it happens all the time. So we don't know what the future of these vaccines look like. We get influenza vaccine every year. And if these, let's say, if the SARS-CoV-2 virus continues to mutate as frequently as we are noticing right now, and if that means that maybe there is a need for an ongoing booster vaccine or a yearly vaccine or a 2-yearly vaccine or a 3-yearly vaccine for this virus, that's also a possibility. So I think there are more reasons for people to get the vaccine, to get it all under control rather than making it worse, because the more opportunity we provide for this virus as a result of transmission and the result of replicating this virus much more than it's needed, it's more likely to mutate further and create more challenges in terms of keeping track of even diagnosing these viruses in the first place, and then the treatment and all the consequences that would come with it.
Thank you.
Any additional questions from AM800?
Dr. Ahmed, the 2 cases of the South African variant, the individuals that contracted the disease or the variant, any idea how they got it when the tracing took place?
Yeah, I don't have that level of detail, Rob, and if it's relevant, we can share it, but at this time, I don't have the detail.
Okay, thank you. Have a good day.
Any additional questions from CTV?
Yes, this one. I'm just looking for an update on the vaccination of the special education teachers over the April break. Did you keep a record, or do you know how many were vaccinated?
I believe we had close to 2,000 names submitted, and most people would have been vaccinated by now, so I believe we're up to date. And we are starting to reach out to the school boards again to vaccinate a limited group of people that are in the hotspot areas, so in the elementary schools for JK, SK educators and staff.
Great, thank you.
Any additional questions from Radio Canada?
No, thank you.
Thank you, everyone.